Hello and a warm welcome to a pleasant discussion of Parotid Gland Anatomy by Dr.Smell-Bell-Verbal Cephalocervical Surgical Series. These videos are intended for easy understanding of the head and neck anatomy as far as an ENT personnel and head and neck students are concerned. Today we are going to discuss about the parotid gland. Para, that is parallel to or nearer to, it is by the side of otic. Otic is the ear that is present over here, that is the parotid gland. It is the largest serous salivary gland. Serous means most of it is liquidy, the secretions are liquidy, and it is present in the parotid region of the face. Parotid region of the face, typically occupying this region. This is the particular region where parotid gland is located, that is in between the sternocleidomastoid muscle and the ramus of the mandible. The best thing about it is related to a facial nerve, that is temporal, zygomatic, buccal, marginal mandibular, cervicofacial. So the 5 branches of the facial nerve are related to this parotid gland. It has got a superficial lobe and a deep lobe. Superficial lobe is external, deep lobe is like deeper, and in between these two will be the facial nerve, like this, as I am holding this one. In between these two will be the facial nerve. So this parotid gland has got vertical placement of blood vessels, vertically running blood vessels, and horizontally running facial nerve. These two are very important while giving an incision to parotid abscess. So it is given horizontally. Parotid abscess has to be drained horizontally, parallel to the facial nerve branches. Even if you give vertical incision in the skin, you have to go internally, horizontally, along with the branches of the facial nerve. The region of the parotid gland extends from zygomatic arch. This is the zygomatic arch above and the angle of the mandible. Zygomatic arch till the level of angle of the mandible below. Parotid duct or Stenson's duct opens in front of that particular upper second molar, the crown of the upper second molar U2M, that is at the anterior part of the end of the buccinator muscle. Two things are there within the gland, that is, number one is retromandibular vein and the particular external carotid artery. Retromandibular vein and external carotid artery. And it has the facial nerve, which is important, that is the 7th cranial nerve, which has got fibers for taste sensation from the anterior 2/3 of the tongue via chorda tympani, except the valate papillae. And the other important thing is it has got the secretomotor fibers for submandibular and sublingual salivary glands. And it has got the specialty of muscles of facial expression. These are the muscles of facial expressions. Parotid gland measures about 25 grams in weight. It extends between the ramus of the mandible and the sternocleidomastoid muscle. And it also sometimes extends till the level of the masseter muscle. Once you are clenching your teeth like this, you have got the masseter muscle here, that is the masseter muscle, and you have got that particular gland extension anteriorly like this. And the skin over is supplied by greater auricular nerve, C2C3, greater auricular nerve. As the ear is supplied this part by the auriculotemporal nerve, here the skin over the parotid gland is supplied by greater auricular nerve. If there is a eustachian tube dysfunction, there can be a radiating pain in the parotid region. Radiating pain in this particular groove. In this groove there can be radiating pain. The parotid is tightly present in the investing layer of the deep cervical fascia, ILDCF, investing layer of the deep cervical fascia. So it is present in this particular region, and it has got two parts, that is a superficial part which is externally present and deep part which is deeply present. This investing layer is supplied by greater auricular nerve, C2, C3 once again. This fascia, investing fascia, splits between, this is the angle of the mandible, and this is the mastoid process. Angle of the mandible and mastoid process. It has got superficial part and deep part. The superficial part is very thick, and it is attached to the particular zygomatic process above. It is also called as perotido-masseteric. Masseter muscle is here. Perotido-masseteric fascia, PM fascia. Perotido-masseteric fascia, which is very thick. That is why it goes into a taut swelling, tough swelling in the case of a parotid abscess. The deep part is attached between the styloid process, tympanic plate, that is the tympanic bone, ramus of the mandible and angle of the mandible. Deep part is attached to the styloid process, tympanic bone, ramus of the mandible and angle of the mandible. It is thinner. Between the styloid process and the mandible, the particular deep part of this particular parotid fascia is thickened to form stylomandibular ligament. Styloid process and mandible. Styloid process, SP and mandible. The layer is thickened to form stylomandibular ligament. Which is very tough. Stylomandibular ligament is pierced by external carotid artery. This stylomandibular ligament separates the parotid gland and submandibular gland. Parotid gland and submandibular gland separated by stylomandibular ligament, pierced by external carotid artery. If you take the contents of the parotid gland itself, lateralmost will be the facial nerve, middlemost will be the retromandibular vein, and deeper is the external carotid artery. As I told you, external carotid artery is the medial most and it is piercing the stylomandibular ligament. Parotid swellings are very painful because of the unelastic nature of this lateral part, that is the external part of the parotid fascia, which is very thick. Suppose if you take the temporal bone as it is, and this is the styloid process as you could see, and this is the zygomatic process. So this is the styloid process, zygomatic process, and here is the glenoid fossa wherein the mandible lies. If here the mandible is lying like this, and you can say that this is the stylomandibular ligament. Styloid process to mandible, this is the stylomandibular ligament. And this is the forming the stylomandibular ligament which separates the particular parotid gland from submandibular salivary gland, and it is pierced by the external carotid artery. So this is the tympanic bone that you are able to see, and this is the zygomatic bone, and this is the mastoid process. From here will be your sternocleidomastoid muscle. So from sternocleidomastoid muscle till the particular level of angle of the mandible will be the situation of the parotid gland. So based on this, you are able to understand the surface anatomy of the particular parotid gland. Thank you for watching the Smell-Bell-Verbal cephalocervical surgical surface anatomy of parotid gland. Part 2 continues with the basic anatomy of the parotid gland, like Smell-Bell-Verbal cephalocervical surgical anatomy understanding. Anatomy is the ship with which you can travel the ocean of the surgery. Thank you very much. Like.